Welcome to Module 3B. This content has a copyright by Teaching Adults, Inc. and may not be copied or reproduced. All rights reserved. Interpersonal skills. Defense mechanisms is essential for helping nursing assistants to understand patient behavior, develop empathy, and maintain professional boundaries. CNA education topic: Defense mechanisms. Objective: students will identify common psychological defense mechanisms, recognize them in patient behavior, and learn appropriate CNA responses. 1. Introduction to defense mechanisms. Definition: defense mechanisms are unconscious psychological strategies used by individuals to protect themselves from anxiety, stress, or uncomfortable thoughts and feelings. 2. Why it matters for CNAs. Helps CNAs understand patient reactions, anger, denial, etc. Promotes compassionate and non-judgmental care. Supports effective communication with residents, families, and the healthcare team. 3. Common defense mechanisms in healthcare. Denial. Refusing to accept reality. A resident insists they don't need help walking even after a fall. Gently reinforce safety and provide support without confrontation. Projection. Attributing one's feelings to others. A resident accuses the CNA of being angry when they themselves are upset. Stay calm, don't take it personally, redirect with reassurance. Regression. Reverting to earlier behaviors. An adult resident becomes overly dependent or throws tantrums. Provide patient, respectful care without treating the person like a child. Displacement. Shifting feelings to a safer target. A resident yells at a CNA after being scolded by a doctor. Remain calm and understand the behavior is not personal. Rationalization. Making excuses for unacceptable behavior. A resident refuses to eat and says, "This food is bad," when they're actually depressed. Acknowledge concerns and report emotional changes to the nurse. Repression. Unconsciously blocking out painful thoughts. A resident forgets a traumatic event or avoids talking about it. Respect their silence, don't force them to recall trauma. Sublimation. Redirecting feelings into constructive activity. A resident starts painting when angry or sad. Encourage healthy expression of emotions. What to do if a resident is denying their illness. A resident becoming angry at the CNA due to another frustration. A resident showing childlike behavior. 5. Key points for CNAs. Be non-judgmental and supportive. Always maintain professionalism. Know when to report behaviors that suggest deeper issues, e.g., depression, confusion, abuse. Use active listening and empathetic communication. Quick quiz 1. A resident says, "I'm not sick. I just like the food here." What defense mechanism? Denial. 2. A resident who just lost a family member becomes very dependent and clingy. What is this? Regression. 3. How should a CNA respond to a resident who yells at them due to frustration from another issue? Remain calm, don't take it personally, and try to redirect or offer support.